the session will be uploaded on the core website after the presentation. And we'll have an opportunity for some question and answer time after the presentation. And we ask you to please raise your hand by using the icon that I'm sure most of us are familiar with using now, the little raise hand icon if you can. As well, you have the opportunity to, if your camera is on, to raise your hand physically, if that works better for you too. Please put some questions, if you have questions for our wonderful presenter today, in the chat box. And we do have a chat box moderator today. So someone from the Alberta Elder Abuse Awareness Council is moderating the chat box. Colleen, thank you very much. As well, we have our technical support person, Cindy, from the core team, who can help with any kind of technical problems that you might be having. So without further ado, I would like to introduce our wonderful presenter today. Dr. Anita Dorczak is an Alberta-based lawyer and mediator with over 30 years of experience in conflict resolution and has been a certified elder mediator since 2013. She was involved in the elder decision-making conflict resolution section of the Association for Conflict Resolution since the section inception and for the last few years. She's been serving on the Elder Mediation Committee for Family Mediation Canada. She has given presentations worldwide on the topic of innovative approaches to conflict resolution, including elder mediation, and is passionate about the rights of older persons. And I have to admit, Dr. Dorczak, that it was hard for me to condense your CV down into one paragraph because it is truly impressive with the amount of knowledge and experience that you have with regard to conflict resolution, and particularly with elder mediation, which is what we are going to speak about today. So without further ado, please, I'm going to stop screen share now, and I'm going to allow you, Anita, to take over the screen when you can.
I am about to appear and just pulling up the slides and getting to the slide. Okay. So first of all, what I would like to say is thank you so much for having me. I really, really enjoyed my conversations with Charlene. So thank you so much. And of course, thank you for all your kind words as well. It is true. I am quite passionate about this, and hopefully I can infect you with that so we can work together on building something better for our elderly population. So let me just start by asking a question. Well, let me start by telling you, first of all, what I will address today. A little bit about what actually it means to be an elder, how we perceive elder people. Then we are going to move into what is elder mediation. And then why should we actually talk about elder mediation? And I'll take you for a little trip back in time as well, just to give you a bit of a historical outline of how this model of mediation evolved, where it was born, and some other juicy details that will follow. So first of all, what describes an elder? I would like you to pause for a moment in your mind and bring up an image of an elder. What does it look like? Does it look like this for you? Well, then I would invite you to take a peek at somebody else. And who is the world's oldest reigning monarch? Can you answer that question for yourselves? Okay, you're doing very well. Now, that is her indeed. Now, her name is this, and we all know that, having seen the picture. But how old is Queen Elizabeth? Okay, let's see if you're right or wrong. This is how old she is. Okay, so going back to the question, well, do you see older people like this? Well, what about this person? And I don't know if there are any psychologists in our meeting today, but he is in the same league as Freud and Skinner and Piaget. This is his picture. Not sure if that's helpful or not. Hopefully it is. His name is Professor Bandura, and he is 95. And I have to tell you, if you don't know, when I read about him, he was born in Mandare. So great people come from Alberta, woo, right? And he wrote a book 5 years ago. When he was 90, the book was published. This is so inspirational. And it's called Moral Disengagement, How People Can Do Harm and Live with Themselves. So getting away from the stereotype, okay, like this, when we go perhaps to a nursing home, what about something like this lady? Anybody? Well, think. Okay, who is she? You may be right or not. Here she is. I love that picture. And of course, this is Miss White. And how old is Miss White? Okay. And you know, when I read about her, she said actually that the secret for staying so long alive and well was that she has a very big house, and in this house she has a lot of stairs, and she always forgets something, so she goes up and down the stairs. So here's the first recommendation: let's get a house with many stairs so we can all go up and down and live to 99. In any event, the quiz, here is the quiz, the first quiz of the day. And what I'm going to ask you to do is, if you would be kind enough to take a piece of paper, please, when you have, hopefully you have one in front of you somewhere within reach, big enough to write a number. And with that in mind, if you have a Sharpie so we could see the numbers, that would be great. And the quiz is, when actually does the old age start? So at what age does a person become old? So this is from Pew Research Center. I was so, I was fascinated by this. You will see how it differs. So for the group of 18 to 29-year-olds, when do you think these young people think that people are old? May I ask you to actually write this on that piece of paper and hold it in front of you so we can see. We'll go to gallery view and we can see the responses from yourselves. What do you think? When does the old age start for these young people between the age of 20 to 29? Can you please go on camera if you don't mind? Okay, so I see some 50, 40 even. All right. Okay, and some other people. Okay, now if we go to the next question, what about the group for 30 to 49-year-olds? So 30 to 49. When do you think the old age starts for the group of people who are between 30 to 49? Can I ask you to hold the page again? 60. Okay. You're wrong. 50, you're wrong. 85, somebody is really on the other side. Come on, come back to us here. Okay, let's see. Anybody else? 65, some people are just quiet and hiding. 65, okay, let's move on. You're actually not too far off. I'll show you the answers in a moment. What about the group of 50 to 64-year-olds? When do you think for that group the old age starts? So between 50 and 64. Now we are moving. What do you think? Page up. What do you think? Let me see. 80. Oh, wow, you're so wrong. The 80 and the 85-year-olds. Even this, okay. Well, the last question, then we'll see the answer. So the last question is for people who are over 65. When does the old age start? Answer, please. Last one, exercise of the day. Hands up, what does it say? Never. I love this. Jennifer, that's a great question. It's all in the mind, right? I mean, it's a great answer, but 100. Interesting. Some people are really shy. For the next quiz, I will invite all of the shy people to become a little bit more adventurous and go on camera with us so we can actually enjoy that. 100, you're wrong, but it's a good guess. All right, let me show you the answers quickly. And it's really fascinating to look at this because for the younger group, for the youngest group, it starts at 60. For the other group, it's 69. For the group of people who are between 50 and 64, it's 72. So many of you were right and very close. And then for the group that we really consider the retirees and old, it starts at the age 74. So here we go. So this is the age perception. Now, this article really caught my attention when I read the title that somebody who is 99 ran, and actually, you know, the 92-year-old runner wants a rematch because he was beaten that. Isn't that inspiring? All right. What about this lady? Let's just see to what. Let's just hear her say something. She was in the street and asked, "How does it feel?"
So, how does it feel to be 91?
Marvelous. It's the best age I've ever been. I just love it. I just feel. At 91, you feel like you're free. You can do what you want, say what you want, and it doesn't matter what people think. It's me. If you don't like it, you don't have to talk to me. But it's marvelous.
So how does...
So then, if we think about aging, please keep that in mind. Get rid of all of the assumptions that they may be completely wrong, as we've seen at least from one research, and we held these beliefs proudly in the light in front of other members of our group. So now, when you think about conflict, what do you think about, where do you take the conflict to? Well, I think that arrow going to the left is the usual mindset. We have a conflict, we take it before the judge. Well, don't. There are other options. And one of these options is, of course, mediation. And let me just quickly contrast the mediation versus litigation. So decision-making, who has the power to decide? Well, of course, in court, it's the judge who gives us the verdict. But when you participate in mediation, it's actually yourselves, right? That's the participants in the process. The process itself is controlled by the participants, unlike in litigation when the judge would adjourn the case or set the trial. So the control is preserved within the family. The time mediation can be much, much quicker, particularly nowadays when it comes to what happened with the courts closing due to COVID. And of course, now the procedures have changed. There are huge delays when it comes to getting a trial date, even going to chambers to have a judge rule on an interim conflict. What about the outcome? Well, the outcome in court is usually that somebody wins and somebody loses, right? And when it comes to mediation, the whole purpose of this process is to bring people together to a resolution that will be acceptable. So it has a completely different outcome. And it's also, the research says that when people actually agree on something themselves, they are more likely to honor this. They are more likely to follow that agreement. So let me just move to elder mediation and talk a little bit about what it is, how is it defined. Let's not talk to our wallets as we move on, as in this cartoon, but let's just talk a little bit more about elder mediation. What is it? So of course, it's a conversation. It's a process of dispute resolution, which is based on open communication, the review of different options, and with the view of actually coming to a mutually agreeable outcome for all of the participants. So this is the definition from our Code of Ethics for Elder Mediators. And what are the goals of elder mediation? Some of them, of course, this could go on for a day or two. This is just scratching at the surface. This is a very, very brief introduction, but I hope to get you interested in this model of conflict resolution. So what are some of the goals? Well, one of them would be this, and I'm very excited to tell you that later on in my presentation, actually we'll have proof. Proof. This is the lawyer's hat. Okay, off. But I will have proof for that. So then, of course, another goal is to have those who care included. And that's very important because with the elder in the family, it may be different people, right? It may be not only the children, it may be also the neighbors, or maybe a neighbor, a friend, a grandchild. The other one is, of course, to look at different options, how we can help, how we can resolve the situation. And what's very important in that process, we can preserve the relationship. And we know that conflict breaks them down. Excuse me, we know that from different research. So this is so important to improve communication, because that will then lend itself to actually preservation of these relationships that might have been broken for many years, many years. For different variety of reasons. What are the key principles of elder mediation? Well, we need the elderly person to be able to make a decision himself or herself. So this is this ability to self-determine, to actually take the decision into your own hands. It has to be done with a consent. We sign an agreement initially, so we explain the process. When I say we, of course, mean our elder mediators. We explain the process, so people who are participate in this process will understand what they are getting themselves into. The process is fully confidential, which is for a lot of people, that presents a lot of advantage in its own right. And there's also, of course, voluntary participation. I had a sibling leave in the middle of the conversation because she was upset. Nobody is going to hold anybody, right? It's just if you wish to participate, please do. As a mediator, of course, we don't take sides, naturally. We remain neutral. We are sort of the guardians of the process. That's from different schools of mediation. That's another conversation. But it's that cocoon of safety, that cocoon of neutrality that we are able to create to create a safe place to hold that very, very important family conversation. So what does the process look like? Well, we start with pre-mediation sessions with all of the parties. That can be done by phone. Nowadays, it can be done by Zoom, but it's very important to hold them because each member may bring a different perspective of the issue. We also know that sometimes in order for the elder to participate, there may be some capacity evaluation just to make sure that the decision would be actually well taken and understood. Then we have the identification of different issues. What are we going to talk about? What kind of issue is going to be discussed? From then we move into the sessions. And of course, mediation is a process. I get really frustrated when I have somebody approach me saying, okay, we came for a session, well, we didn't resolve everything. Well, you didn't, because life is complex. If life were so simple, we wouldn't need any judges or any mediators, right? So the sessions continue depending on the number of issues. It may be a couple of issues, it may be 5 issues. Of course, the process will be longer, depending on that. At the end of this, hopefully there's some sort of an agreement reached. And when we reach this agreement, what's important to keep in mind is that it can be reduced to writing. So we can actually write a plan. We can write a plan who's going to help, how they are going to help, what they are going to do. And with writing down, again, research says that people are more likely to follow through, to honor what's written down. And finally, there is a post-mediation check-in. So essentially, maybe a month after, we can check in and say, how is it working for you? Do you need any change? Do you need any encouragement? Is there anything that happened that requires everybody to come back to the table? So what is my role then in all of this? Well, when I meet with the family, I would facilitate the discussion. When there is something that's not clear, asking questions, but asking questions not in a threatening way, not in, why did you do that? It's a way of asking questions to elicit the information that will be helpful. So the questions are usually open type questions, so the issue can surface as a result of the question having been asked. It's also helpful, I think, in particular when we are having mediations with older people, to summarize the issue, to summarize the part of the agreement that is becoming clear to the people who are participating. And that summary can then be used as a sort of little tiny part of the agreement that is being born as we are having the discussion. It's also important to identify what drives the decision making, because it's usually interest. So somebody can say, I want to stay in the house. And it looks like, well, why do you want to stay in the house? Well, I want to stay in the house. That's it. And yeah, I've heard these answers when I talk to older people. I just want it because. Well, would it be okay if you share with me a little bit? What does it mean to you? And sometimes they will say, my kids were born. I remember the room, the pink room with the beautiful walls, and I was changing the diapers there. That's my baby. So there's this huge emotional component to it. Once we hear from everybody involved, what we do is we, as mediators, we encourage the options. We have to look at options. We have to look at different options without criticizing the option, without actually saying, no, this is not good. This is up to the family to decide what's good. What's good for one family may be completely not good for another family, or maybe not completely, but they differ. So how is the elder mediation different? Hitting right on that, we concentrate on the elder. We also have different parties. I alluded to it already, that there may be family circle. There may be somebody else who is involved. People join in by calling, people join in by Zoom from different parts of the world or different countries. That's quite common nowadays. Of course, there is mobility that has increased over the years. So not everybody can be actually present at the table, so to speak. And because the older person usually would have kids and then grandchildren, sometimes great grandchildren, this kind of mediation tends to be multi-generation. And also, it's hard to have one issue. Usually there is another issue that pops up. So you have sort of here on this slide, the sort of key differences when it comes to elder mediation as opposed to family mediation when we have two spouses coming to the table and talking about this. I'd like to invite you now to relax. Please sit comfortably in your chair and let's take a look at the beautiful scene from the notebook. And I will assume that you have seen the notebook. If you haven't, please do have one or two boxes of Kleenex ready. It always requires a lot of Kleenex from me when I watch it. Let's just enjoy the scene here. This is, of course, a love story for those of you who might not have seen it. And this is a story with the husband sort of being asked some questions by the doctor. So let's just look at, whoops, I just touched something. Let's just look at the notebook here.
The shaking is normal. It's just a side effect of the haloperidol. Are you all right?
When she first came here, she remembered me every few days, then every few weeks. It's the first time in 3 months. She was there and then she was gone again.
You know, night confusions are a part of the disease. The nurses, they call them sundowners. Lots of screaming, paranoid fantasies. Nobody really knows why it happens at night. It's just the brain shutting down, I guess.
Yeah.
So if you don't mind me asking, how did it start?
Mm-hmm. Oh, well, I started with her asking the same questions over and over. She'd forget where she put her car keys. She'd forget her neighbor's name. I took her to the doctor when I found her in a car less than a mile away.
Allie?
Allie?
What is it? What's wrong? What is it?
She couldn't remember how to get home.
I'm sorry to tell you this, Allie, but you're in the early stages of Alzheimer's.
When we went home, she went to work with a vengeance. She wrote her will. She left burial instructions. She wrote letters to the children.
Okay, have something for you. That notebook is all about us. How we met each other, how we parted, how we got back together again. How we loved each other. In a few years, I won't remember any of it. And when that happens, I want you to read it back to me. It doesn't make any difference where I am or where my mind is. Just read it to me. I promise you, if it is humanly possible, I'll come back to you.
It's a remarkable story.
Well, it is a remarkable story. Love stories are a lot of times remarkable, and the support that she was getting is remarkable. But you have seen in this clip what happened, and was the memory. So Ali was experiencing these problems with the memory. So what happens? We have to, in elder mediation, we have to be aware of different changes because of the nature of the client. So one kind is cognitive changes. So what happens when we get older? Well, the memory goes down, right? Also, the word finding declines. So maybe that, yes, I know what is it, and we can't name it, despite the fact that you're becoming wiser with age. So there is more life experience, there is more vocabulary that is accumulated. Sometimes it's just that inability to find the word that may actually stall the conversation. This is one of my favorite cartoons. Please take a moment to read it. Hopefully we'll put a smile on your face. And I see some faces with smiles. Awesome. I think that's great. I wish to live to something like that, you know, to actually be told. That was me reassuring. We have to be aware of changes that are, well, on a cellular level. We are aging, so our bodies do age inside. We cannot stop that completely. So of course there are changes when it comes to vision, when it comes to hearing as well. We know from statistics that about 48% of men and about 37% of women who are aged over 75 would have some hearing impairment. Also, when it comes to the vision, about half of North Americans would have cataracts by the age of 80. So also dementia, of course, is very prevalent. I'm putting on the slide here some information about that from Canadian statistics. It's really frightening when you think about 25% of older people who have some form of dementia. We know globally that dementia is also very, very prevalent. Over 50 million people live with it. And this is really quite something when you think about the time and how many cases are being diagnosed worldwide. Well, that brings us to talk about awareness of changes, what the mediators who are mediating with other people must keep in mind. That brings us to another quiz. And this quiz will require, again, a pen and a pencil. If you could grab it, please, so you can move a little bit. And it's not going to be a number this time. It's going to be the actual word that I'm going to ask you to write down. So first of all, here's the question. So please listen carefully. Which chronic condition is most prevalent in the 65 plus population in Canada? And I'll give you a list. Here's the list. And then I need you to take a moment, maybe 15 seconds, to think about this and write down on that piece of paper, what do you think it is? Which is the number one? Which would be the number one? And if you could go on the camera, that would be very much appreciated. If you could just go on the camera, please, so we can see the responses. Okay. Wow. So many of you are wrong. I was wrong too, if that goes for anything. When I looked at it, but anyway, okay, let's see. We have some brave people who are holding up the paper. Thank you so much. You may be surprised. I haven't seen the right answer yet. Okay, enough of the suffering. Let me just cut it. So let me give you the answer. So what is the answer to that question? Okay, going to the next slide. This is it. So if there were any of you who responded correctly, and I didn't see it, my apologies, but I did not seem to see that, starting with an A. And then we have the other conditions that are prevalent in that age group. So of course, we have to think about this when we mediate, because somebody with arthritis may not be comfortable sitting for a long time, may not be able to climb the stairs to come upstairs. Maybe there's an elevator, maybe there's another accommodation needed. What are the issues then that we mediate typically in that kind of mediation? And these are just examples. The issues, this is not an exhaustive list, but a lot of issues revolve around health and sort of health, well-being, medical problems. Living arrangements are quite common with, is mom going to live at this facility or that? Can we afford to pay for that? Is there a wait time? When is it going to happen? The very important theme in all of this is the care for caregivers. And it's very important because caregiving is very, very exhausting. If any of you have ever cared for an elderly person, particularly somebody with dementia, it can be very, very exhausting, and it affects the health of those who are providing care. Actually, about 50%, I think I had it somewhere here, about 50% of the people who are caring for others say, 50% of carers globally say that their health has suffered as a result of caring responsibilities. And of course, that has a ripple effect on how these people function in their families, how they then take care of their kids, because a lot of, I dare say, us are in the generation we call the sandwich generation, with the parents who are in the 80s or 90s, and then the kids who are teenagers and give us a lot of challenges as parents. And then on top of that, kids who may be in the 20s and they're getting married, and it's very complex. So we have care for the caregivers that really should be a focus as well, and end of life decisions. A lot of philosophical discussions, a lot of conflict at the time when the elderly person may be brought to the hospital and it's not clear as to what is to be done. That brings me to some other issues to be mediated, like personal directives. It's so important to have that. I mentioned that I talked about it in my blog. I actually started blogging not too long ago, last year, as a result of the pandemic and the courts having been closed. And I'm talking about PD, personal directive. Do encourage family members to write one up. It's so important to have that. And the same with enduring power of attorney, which is, of course, dealing with the, maybe not, of course, which is dealing with the financial issues, as opposed to personal directive, which is concentrating on health issues and the treatment and other ancillary issues to that. Is it the driving? Is it that mom drives the car and maybe she drove into a pole or didn't make it to the garage? Is it dangerous now? And of course, there are intergenerational issues just because of the nature of the kind of the makeup of the group. Benefits, are there any? Oh yeah, there are benefits of elder mediation. And there's proof. I mentioned at the beginning, I'm getting to that proof as well from research. But what's important to keep in mind as a result of this kind of conversation, seniors will maintain the well-being and dignity. The family is able to work out a plan when they may share their responsibilities, they may share their duties. They start talking. So the siblings who probably haven't talked for 20 years or so because mom gave something to that sibling and not to the other, and as a result, there was some gift at the wedding or something, and for so many years they haven't spoken. Now the relationship may actually improve as a result of that mediated conversation. The neutrality helps. I think that's a factor that is really valued by the families, that it's in a neutral setting with somebody who is not going to take any sides, but just guide them through that conversation. And of course, this is something that is very, very important. I think that's probably, if the family can talk, issues get resolved, don't they? So really, that whole aspect of improvement of communication is crucial. But it's not so easy. There are some challenges that we have to overcome, a lot of them actually. So the predominant mindset, I don't want anybody to know about me. I don't want to know about what I do, who I like, don't like, what condition I have. I don't want anybody to know. So don't do that. Don't air our dirty laundry. The other, and this is mind-boggling, but it still is the issue that mediation is not really very well known. It's still not known. I mean, it was born in the 70s in the States, in the 80s in Canada. It started off as family mediation. And still, even when I have the privilege of assisting a couple in sort of with any kind of problem, whether it's parenting or anything else, they wonder, is that an option? Yes, please. If you can take one thing from this presentation, please do speak to anybody who needs help with a conflict, that there is another way of dealing with it, and it has nothing to do with the courts, nothing to do with litigation, nothing with the destruction that the litigation brings to the families. And then, of course, there's this whole issue of ageism and stereotyping. And I showed you some slides at the beginning. Elder people not capable, not being able to do this, just should be put in the corner over there. Well, what about the wisdom? What about all of the positive attributes that they bring? I mean, we need really to do a lot of work to work on ageism and get rid of it as much as is possible to be able to give a better future to the older members of our society. And then, of course, there's abuse. And I think I'm speaking to the group of people who are very well familiar with that. So the part of presentation about this is very brief, but I do need to introduce it because, of course, the point of this is that elder mediation will or will not help, but it's coming up. So why should we talk about the mediation? We should talk about it for different reasons. And I'm going to just give you an idea of 3 main reasons why to talk about this. So the dominant factors, number 1, just pure world statistics that we are getting older. And if you can, the population on our planet is getting older. And according to some research, there will be about a third of people living on this planet will be over 60, and it's coming. Also, aging causes a lot of deaths, but we live longer, we live much longer. And this is our life expectancy now. For 1900s, you can look at the numbers, how low. It's really quite, when you look at this, it's unbelievable where we got from this to now. Halfway through to now, so to speak, in the 60s, the life expectancy, of course, grows. And then right now, right now, it's even higher. And, you know, when we look at this, let's look at Canadian flag. A good place to live, right? Look at that, 82, our life expectancy. So we have the more people getting older. We have people who are older, and in sort of the mass, the numbers, they live longer. And then when you look at the concept of the family, that invites a whole new conversation. I mean, that could be half a day spent on this alone. I have this image because I wanted you to look at different faces. What do you see here? We have the elderly couple. We have maybe their daughter, or maybe not, the lady on the left of the slide. And then we have people coming from different backgrounds. We have people from different ethnic backgrounds. We have different ages. We have the grandchildren potentially here. Maybe one of them was adopted, maybe not. So this is the complexity of the family. When you look at this picture, you can imagine some of the issues that may be seen differently coming from the angle of the gentleman on the left, or, you know, the lady on the right who looks like maybe from the Philippines or somewhere there. So the cultural values, the cultural sensitivity is also very important to be kept in mind. And here we have just a quick projection of the group of people who are getting older. Well, we are getting to about 20% of our population of people who are in that age. And now, because I don't want you to fall asleep or anything, I'm going to subject you to another quiz. So please get ready, the quiz is coming. And with that quiz, this is going to be a question about a country. So again, if you still have a piece of paper, that would be great. And here is the question. You've heard some statistics from Canada. Now, which 2 countries in the world have the highest percentage of population over 65? Some of you may have traveled the world. Some of you may have seen the data in different books that we read. What do you think? If I could invite you, please, to go on the camera, if you'd be kind enough to put the page there so I can see, we all can see our responses. That would be great. Let's see, we have one I see here, other countries. Okay, some of you, one of you is right, oh yeah, okay, one of you with, yeah, some of you are still wrong. Oh, okay, Northern Europe, close. China, okay, somebody with Japan in the middle, all right. Okay, thank you. Some people are very right, very right. Okay, so let me just reveal the answers for you for this. And this will be in a graph form. So those of you who said Japan, I saw a couple of ladies holding Japan. You are absolutely right. And the other one came as a surprise for me because it's Italy. So those of you who said China, look at that. Isn't that surprising? And again, it's how we kind of stereotype, you know, even culturally, where do, you know, which country does have the most, the population of 65 and older. Of course, in Japan, it's the island of Okinawa that has the most of centenarians. And it's fascinating to read about how they live, what they eat. Of course, the interaction, the social aspect. is so highly valued. There are clubs that they have, and the ladies come and do sort of like gardening together, or, you know, reading books together, talking, walking. So this whole socialization aspect is so important, keeps them alive for many, many years. So on the one hand, we have the Declaration of Human Rights, where the rights of the elderly people are being protected. And on the other hand, we have the abuse, and we have abuse defined by WHO as the act or repeated act of in any relationship where there is harm to an older person. And that harm is really very broad. It could be as horrible as homicide. Unfortunately, that does happen. Or it could be something resulting in an assault causing bodily harm, or simply psychological. What kinds? Well, we have different kinds of abuse, as you all probably know very well. My focus today will be actually on financial abuse. And that's what I want to address. And this is the article. And I'm extremely excited when Charlene and I had a conversation months ago, and she suggested the subject. I said, what am I going to find? I want to, you know, in my lawyerly head, I need proof. I need proof to be able to convince people that, yes, there is value to this service. So I was delighted when I was doing research. I was delighted to come across this particular article. If you see at the top, it was accepted for publication in December. So it's very, very recent. It's just from the end of this year. And this article is written by two Australians. And I have it here. What they did actually is they studied elder mediation and its mediation as intervention, and wanted to establish whether or not it could assist in any way in the prevention of elder abuse. So there is a professor in actually it's from Adelaide, the city that I have a soft spot on, because that's where I got my certificate for in elder mediation in Adelaide at the University of South Australia. Dr. Bagshaw is her name. Did this study, and she actually had 500, and I'm just going to tell you a little bit about the study. The sample was 555 people. The average age of the participants was, not the average, the age ranged from 40 to 74. And they looked at a collection of the data from older people in an online survey and focus groups. And what they have come to conclude is that family mediation assisted in the prevention or cessation of financial abuse. They also came up to conclude that elder mediation requires specialist knowledge, experience, and skills to decide whether or not the older person can actually engage in the process. And they also found out something that we probably intuitively know, but it was confirmed in this research, and that is a very strong sense of rights of the perpetrators to the assets of the elderly people, whether it was, you know, going to the bank account, whether it was asking for a loan and not paying back, anything of that nature. But the key proof here is that that particular intervention, that particular process can prevent financial elder abuse. And they conclude that there's, of course, more research needed to be able to see if it could assist with other prevention aspects as well. And you know, when we look at this in Australia, and I'm kind of jealous of this, but in this article, they have reviewed hundreds and hundreds of studies. And they actually committed, the federal government committed $18 million to the national plan to respond to the abuse of older Australians. And it's underway from 2019 to 2023, and commits to the 3 service models. One is health and justice partnerships. The other one is specialist elder abuse units. And the last one is mediation and case management. So it'll be very interesting to see in 2023, when this is over, what data will emerge from that particular study. So now, okay, this image gave me shivers whenever I look at it, but the redness in the face, of course, is anger. This is from WHO, and it's just 16%. It's almost every 5th person of, it's just, anyway, statistics. Consequences of elder abuse. All right, so many. Again, from this particular article, after looking at so many different ones, and I would invite you to look at this article if you're interested in that subject. So the consequences of elder abuse, we have them here on the slide, of course, injuries, poor health, deaths, and psychological distress, and particular psychological impact of elder abuse, which leads to anxiety, depression, trauma, sleep disturbance, and loss of dignity and hope. And, you know, when we look at this and think that it happens in the family, how terribly sad it is that an elderly person cannot rely, cannot trust somebody who once was in the diapers and was looked after. Anyway, we are all aware of this, I think, of this day. Hopefully there will be many conversations and presentations in different settings to bring awareness to this problem, which is a huge social justice problem all over the world. And with that, all over the world, let me take you back in time. So let's go back in time. I do like this cartoon. If you could take a look at it. If you're not looking at the screen, please do. Hopefully it will put a smile on your face. Let me take you back to the beginning of how was elder mediation born? Well, it happened in Ottawa, and I'm very proud to say that there's research from our country. There are people and there are mediators in the East, particularly in Prince Edward Island, in Newfoundland, who are very experienced, and that's kind of the birthplace. But the first summit was in Ottawa at Carleton, and then from then there was an ACR meeting, Association for Conflict Resolution, in Atlanta, and I remember sitting there at the Hilton with the horrible brown bag lunch with the soggy sandwich, and we're chewing on the sandwiches, sitting in a circle and trying to decide what to call it, what to call this section. And of course, senior mediation or elder mediation, or maybe aging, or whatever. So ultimately it was called elder decision making and conflict resolution. And I had the pleasure of being in that committee for 5 years or so, with monthly meetings and presenting, interviewing mediators, and building the resource library as well. And then we have Elder Mediation International Network. I would invite you to visit the website. It has information about elder mediation, has information about the summits as well. So every year, we started every year. I've been to all of these. I've been to actually all of the summits. I think that's the topic that really needs to have a much wider and bigger conversation across the country. So these are the recent summits. Unfortunately, the one that was scheduled for 2020 in Denmark, in Copenhagen, had to be canceled because of the COVID issue. So anyway, as I travel to these different places, I've presented on different topics. I think I just want to highlight how important it is to keep empathy in mind, to be able to have compassion as well, to be able to have self-compassion for ourselves as well. Whether you're a caregiver, whether you're a mediator, you hear horrible stories and they hurt. So it's important to keep that in mind as well. And also, for other organizations, I had the pleasure of presenting for these here, and it was interesting for the International Academy of Law and Mental Health. There was some interest in the doctors, but I think they are so focused just on the disease itself that, to expand the horizons, that the disease can be maybe halted a little bit if the stress level is diminished and if the conversation happens in the family. So we need more research, more persuasive powers to bring it to the healthcare setting, but I hope that's going to happen. In closing, just in case you wondered, how does one become an elder mediator? So quickly, you have to have a degree in a related discipline, maybe social work, maybe law, maybe psychology. You need 100 hours of actual mediation training, additional 100 hours of elder mediation training. If you want to be a practitioner who is, quote, advanced, there are 2 tracks nowadays. You also need to write a 3-hour exam. You have to send a role play that is videotaped, and it's assessed by the people who look at that. And then you're certified. Once you become certified, you have to actually uphold your certification. You have to continue to learn, and you have to adhere to the code of conduct, which is very important. I think that gives credence to this profession. Unfortunately, this is not regulated. which is very unfortunate. In the States, they have the Uniform Mediation Act. I'm hoping that it will come to Canada. If there's some coming together of the people to whom mediation will be really meaningful, I hope we can change the world here, at least in our beautiful country. So what I'd like to do is invite you to stand up, if you don't mind, please. I'm going to show you a quick video, and if you don't mind, because you have been sitting very patiently for a long time, please do stand up and let's engage with these older people who are not your typical older people. Let me start.
Good night, Mr. Goldblatt.
Good night.
Nosotros somos jóvenes, así que vamos a poner el mundo en juego. Podemos quemar más brillante que el sol. Esta noche, nosotros somos jóvenes, así que vamos a poner el mundo en juego. Podemos quemar más brillante que el sol. Llévame across the west and llévame across the...
And okay, going back to the retirement home, the night on the town. So here is my information. Thank you so much for being so patient and listening. I hope that this presentation will lead you to some reflection and will spark some interest in this kind of mediation, because I truly believe that it's needed. It is really needed for so many older people. Sorry, I get emotional, but it is, because there's so much suffering that goes on, and this is just one way to stop it. So thank you so much, and
Thank you.
And to questions.
Thank you so much, Anita. That last 10 seconds of what you just spoke about and how you reacted to it was why I, if you would allow me to say, fell in love with the person you are the first time I spoke to you, which is why I'm so glad that you were able to join us today after months of us talking about this. It's finally come to be, and I look forward to supporting you in some other ways to spread this message throughout our province. So thank you for that. I'm just gonna see if we can, I'm gonna try and get back and see if I can now take control of the screen again and go back into my last couple of slides if I can. Actually, let's forgo that for now, because anything I have left to say is really irrelevant to, or I shouldn't say irrelevant, but I think let's open it up to people having some feedback right now and some comment. And we're getting so much, so many things in the chat box about thanking you for sharing your presentation and your words. So really appreciate that. So I know we have someone monitoring the chat box, but I do want to say there were a couple of things that I did pick up on. The one was, there was a comment about a video, I believe, or a book it was called, If You're Not in the Obit, Eat Breakfast. So that was kind of cool. So that's just something that one of our participants said. Jacqueline had put in the chat box a comment that when she was going through her divorce, she was discouraged by her lawyer to do mediation. Now that's within that spousal divorce situation, but do you see elder mediation as something that's really taking a hold, or is there some pushback not allowing it to really get ground?
I think we need to get to the people who care. And I'm going to take my lawyer hat off, because despite the fact that I have been practicing law for so long, I have had the presentations for the CBA, for the Canadian Bar Association. I did it twice, I think in 2015 15 or and 17 or something like that. After the summits, I come after the summits all energized and ready to conquer the world. You know, this is something we need to talk about. And I must say that the lawyers have not been very much interested. And you know, again, going back now to the other sort of mode, I think it's important to appreciate the preventive nature of that particular type of mediation. And it's people who are, I think, in the health sector, people who are in a social sort of work field. I think if these people got more together as opposed to lawyers, okay, I don't think lawyers will be driving this, despite the fact that I'm one of them, but anyway, I may be a strange, whatever, strange apple or something. But I think it's important to appreciate what it can do to enhance the quality of life of the older person. And only those people who are interested in this and really care will be able to appreciate that. And that's where the research should come from. I think that's where the focus should be, because then we create proof. And legal minds are, we think, again, head on, we think about the proof. So the proof is, of course, now we have from Australia, the proof that at least, you know, in one aspect of abuse, there is proof that, yes, it's actually going to work. Now, the other thing is mediation is slow. It's very slow in terms of people getting interested in it. And we tried the different ways to do it. I'm not sure what will be, it's about marketing, and I'm not a marketing guru. But I think what's important to understand also is that it hopefully will change because of the very recent changes to the Divorce Act, where now the lawyers have the duty, imagine that, duty to advise of the other ADR processes being available to people. So I think with that, you know, and with some changes, hopefully in other legislations as well, slowly, when there's this duty imposed to open the horizons of people who are in conflict, that it's not the only option to go to court. It's not. It should be the last. It should always be the last.
Awesome. Thank you for that, Anita. There are a couple of other things Brenda has put in the chat box. Finding a mediator in rural communities in the province might be more difficult. So there's that comment. And then as well, Cindy from Calgary has asked if there are mediation supports in Calgary, or is there somewhere where we can go to find qualified mediators in the province?
Yes, you can go on Family Mediation Canada website, and if you search elder mediators, there are very few of us in Canada actually who are certified. That will give you the list of people, and then of course there are links to click on the websites of these people who are certified. And I think if we get, it's sort of I'm not sure how to phrase it, but because there are so very few certified elder mediators, I think if there are families coming to us and we are able to help, and the families will spread the word, you know, that may have some impact, and hopefully other families who will need this kind of service would be able to engage in it and look for these people. I mean, it's so important to spread the word, to have that conversation, to make people aware that there are other options. And people don't know. With rural areas, of course, you know, that proverbial Zoom, I see little rectangles here, and some of you are kind enough to be on the camera, and thank you for doing that, so I can see the faces. But, you know, a lot of people just would phone, and that's okay as well. So, and the computer skills, I mean, there are so many factors, right, that may prevent the actual convening of the mediation. But we can overcome that. If people are willing, it happens. I mean, look back at your lives. If you wanted to do something and you committed to it, you probably had succeeded in it, right? So it's that mindset. We have to change that, because we are very much court-driven in this part of the world, very much. And these darn American movies, I always laugh when I present, I always talk about this. These, you know, Suits and whatever, what was it? LA Law or some other, whatever it's playing now. I don't watch television, but anyway, all of this American model, when the lawyers come and say, I submit, I win, you do. Well, it's not like that for the families. It's different. It may be like that for a commercial case. You have to tell me to be quiet, Charlene, please, because I'll take everybody to lunch, and I don't
listen. I'll tell you something. We actually have almost 26 minutes, and I could listen to you talk forever. And I knew that about you the first time I spoke to you. The passion is there, which is something that we need. So thank you for answering that question so thoroughly. I haven't seen anything else in the chat box as far as questions go, Anita. There's one comment someone had, Judy, thank you, has suggested that perhaps Alberta Senior Supports, you know, maybe that's an avenue to have a list of mediators somehow connected to that Alberta Support Center where people go for information. Also the ACSW, which is the Alberta College of Social Workers. So more information needs to maybe go to social workers, that this is a line of professional route that perhaps some of them could be looking at taking once they get their degrees. So because there is, I mean, I got a hold of you, Anita. I became familiar with you through the Alternative Dispute Resolution Institute of Alberta, or ADRIA, because I was looking then, I have some background and some education in conflict resolution at a very, you know, introductory level. But I see with what we do with elder abuse, and if there's any of the people who are on the call today, on the line today, are coordinators or working within their communities within these coordinated community response models, I see from my experience that the mediation part, negotiating and navigating those conversations with family members is critically important to so many of these situations where it's not necessarily, very rarely is there a criminal element to abuse, at least from what I see. It's more of a lack of communication, breakdown of communication, not listening to what the senior's wishes are, not taking into consideration what he or she might want, and that lack of control, or that control is taken from them. And so that's why I contacted Adria and had a conversation with Paul Conway there, and he said, hey, I've got a lady you need to talk to, which is how we ended up here. So I think that there's a lot more work that needs to be done in the province for us to catch up to other parts of our country and the world. So hopefully this is a step forward. There's a comment that says, how much of your work is grandparents that are being alienated from grandchildren? It seems rampant. That's from Arlene. So Anita, do you have something to say to that?
It does happen a lot, and it's so sad because I'm not a grandparent yet, but for those of us who are, I'm being told by the friends that this is the most enjoyable part of our lives, to look at the little ones. And, you know, the grandparents do have the quote rights as well, I mean, in our laws. But again, it's coming back to that understanding that we have to restore the communication in the family. And that's the key here, right? We have to start with that in mind and create that willingness for the family members to actually engage in that kind of conversation. Ultimately, I think it comes down to respect. It's just respect, and respect for dignity, for the human being, the fellow human being who is suffering, like, you know, many of us are, because each of us has a different family makeup. And I think a lot of us on this call probably have experienced caregiving also, and you know, how the grandparents would love to have the contact with the family and the isolation. I mean, there are so many issues that are being sort of interwoven into that whole concept of, you know, the grandparents and grandparents' rights, the grandparents not being able to maybe connect because of technology challenges. There are programs. I really, when I looked at the network, I have to commend all of you who are doing this wonderful work, because there's so much being done. I wanted to get some information, some basic information about abuse, etc., just to kind of as a segue to present the research on elder mediation. And I must say that you're doing wonderful job, and it's thank you for doing that. Because I think the more is being done, ultimately it's going to burst. I mean, it has to come to the point that it will have to become known. It's about raising awareness of people who are in need, and they don't know still. I think a lot of families still don't know where to turn. And I would be delighted if there was any need to present or to, you know, to run a workshop on this, to maybe start the education, or you know, in any way, if I could, I would be honored to do that, because I think it's really something that is very, very needed, this kind of process, to talk about it, at least to spread the word, you know, so people will be aware there's an option.
Yeah, thank you very much for that, Anita. I'm seeing Cindy on camera. She's bobbing her head like, yeah. So that's awesome. Thank you for that, Cindy. And she also said that in the comment in the chat box, in her experience, elder abuse is so hard to prove that we need resources to prevent it. And I couldn't agree with you more. And I think that mediation is one of those avenues that we can use, education and awareness for sure. Yeah, and there is a lot more work going on in the province from a preventative approach as well as a responsive approach. Jacqueline has a question, and Jacqueline, if you would take yourself, because I'm not sure that I quite understand it. So Jacqueline, if you'd like to take yourself off mute and ask Anita directly your question, please.
Yes, I took the training for the It's Not Right, and I'm going to be facilitating that in our community this year. And one of the things that we come up against is that people really have a pushback when you don't want to call it abuse. And one of the things that I'm interested in is how, you know, a lot of people who are, say, elders now never had the experience to be able to learn about dysregulation. And I'm wondering if it might be easier to reduce abuse if we taught people how to emotionally regulate themselves. Like if we just did that in sessions, rather than labeling it, you're an abuser, you're being abused, you're being neglected. So I wondered what your thoughts were on that.
Well, I think labeling is always dangerous. I would never do that, first of all. And I don't think you meant the question that way, of course. But I think it's about being present, and it's about being present in a meaningful way. And I personally, when I prepare people, I'm certified in mindfulness-based stress reduction. I took that training, and I have been meditating. I'm a yoga teacher as well for many, many years. And I think this allows us to be present in a way that is meaningful to the family. And I also invite the members to actually have a quick prep session with me. And we just do a little breathing exercise. I would always stop if I see that the tension is mounting, whether this might be one of the interventions or not. But I totally agree with you that it's, you know, calling the name would be very detrimental to the process, right? So it's sort of saying, I see there's some tension here. Perhaps we could take a moment and, if possible, stand up, change just what I did with the group and said, you know, please stand up and let's just move and let's just breathe. Let's just breathe for a few moments. And you don't have to say anything right away. You can take your time. You know, when I did some research, I presented on silence for American Bar. And when I was doing that research, can you imagine, can you guess how long we take how much time we take to respond when conversation is happening? Just think about the question for a minute. How long do we take to respond during the typical conversation? Okay. Would it be surprising to you if I told you 1.2 seconds? 1.2 seconds. Can you imagine? So it's like almost talking over one another. So in mediation, we have to create that space and time. So I say, you know what we can do? Oh no, I have that in the other room, but I have little brains, little stress balls that look like little brains. And I say, okay, here's your brain. Okay, just squeeze it and count in your mind to 5. And there's silence, right? Please, nobody talk. So we can kind of come back to the present moment. So we don't have to say anything right away. People get very defensive, right? When you're talking about the difficult subject. Well, no, it wasn't me. Okay, well, stop. Okay, let's just create that moment, that 10 seconds. I call it the 10-second rule. So just in your mind, just count to 10. You know, it's not very long at all, but people say, oh, it's so long. No, it's not. It's not long. You can do it. So there are so many different ways. It has to be catered to the family need. So once I'm able to see the faces, that's another passion of mine, you know, research about faces. That's such a huge wealth of information. You see the engagement in the eyes, you see the mouth, you see the nose, whether it's moving, where there's a movement of a eyebrow. There's wealth of information coming when we talk. And, you know, this is kind of going back to my roots. My doctorate is in semiotics and the theater. So that was the good times when I didn't think about being a lawyer and then being a mediator, which actually now brings me back to this whole thing about semiotics, which is the science of signs and codes and systems of communication, and the theater. And this was the theater of the absurd with Beckett and Ionesco, the names that may resonate with some of you. So communication here and creating that ability, that space and time to talk is really key. And it's difficult to manage. It's not easy. It looks easy, but it's not.
Wonderful points. Thank you, Anita. I hope that answers your question, Jacqueline. And I'm just, Teresa had put in the chat box that we also need to remember that a senior's refusal to engage in negativity does not mean there's cognitive issues. It may be the senior simply not knowing how to engage or scared to alienate family.
Oh, absolutely. And this is such a big issue. It's everyone on the call who works with people who may have been abused, knows that there's this fear, the consequences of isolation, ability to be cut off from the grandchildren. Can you even begin to imagine? You know, if you do that, you're not going to see the child, okay, or the grandchild. You're not going to see little Johnny, okay, if you squeak. All right. So, you know, things like that are just horrible. Horrible. But yes, there is and that's why the conversations need to be happening in different settings, because the legal setting is probably the least receptive one, because the lawyers rely on the laws, right? And we go to court and argue, and we lose and we win. And how is that helpful? Okay, you hear my bias, right?
No,
loud and clear.
But it's so true, so very, very true. Judy has put in the chat box that her thought is that our law enforcement officers would benefit greatly from further training in this area. What are your thoughts on that?
Oh, I think so. I agree. I absolutely agree. And I think there should be, you know, okay, I'm going to venture to share with you, and please forgive me, but I'm just going to say it anyway. If I had a magic wand, okay, and I don't know where it is right now. I think I, you know, may have lost it somewhere along the way. But
for some reason, it doesn't surprise me that you actually have a magic wand.
So if I had a magic wand, okay, this is from the Freud Museum in Vienna, and I love it. It's a psychometer, so you know, just measure. But anyway, so if I had a magic wand, I would have a conversation, and I would have elder mediation, or elder mediator, or elder mediation option posted on all the doors of all of the hospitals, long-term facilities, any retirement homes, any courthouse buildings from the outside, because they may not let us never mind. Anyway, so any facilities, any stores, any clubs, any places where older people, and we know from the research that I presented, plus your answers, thank you for obliging me, we know that the perception of age is extremely subjective and varies, and it's quite wide. So I would have with the magic wand, I would say, in conflict, go to Elder Mediation. Here is the website, you know, and talk to us. Just please talk to us, because we can help. And I think when people come after, you know, after practicing law for 30 years, I have seen so many horrible stories. I'm sure you have your share, but I have seen so many horrible harm being done to the family on so many levels. And it's just mind-boggling that people can be so cruel, but can be so incredibly cruel. And I think that, you know, people who come to understand that can be, all of you can be the ambassadors right now for elder mediation. All of you who have heard this and you believe that there is some value, and you may agree or you may disagree, and I respect that. But for those of you who actually have seen that there may be some value in this service, please talk about this. Please mention that. You know, I mean.
Thank you, Anita. Yeah, I mean, I can't speak for everyone else on the call today, but I know that what you're saying, I mean, I wish you did have a magic wand and that we could have elder mediation in some form everywhere. And maybe we can. And I know there's a number of people joining us today who are some pretty creative and wonderful advocates for elder abuse prevention. And, you know, I think it deserves more conversation for sure. Cindy had mentioned, just in reference to your, what you were talking about earlier in the conversation, and people responding and allowing to give time for older people or any people really to respond to a question. But she said that if someone has dementia, they recommend waiting 15 to 30 seconds for the person to respond to the question. So really great, really great comment there, Cindy. And then Arlene has suggested that perhaps the 211 people, you know, where there's services in this, you know, probably in the urban centers more, that elder mediation needs to be put into the 211 database too, which I think is a great idea.
Yeah, please don't hesitate, Charlene, please don't hesitate to contact me if there are any ideas. If you think that I could help in some way, I would be honored and delighted to assist. I think, as I said, you know so much better than I where to look, where to incorporate that service if you feel that there is any value in it. You know, we are all in this trying to assist the older people to preserve their dignity, to be respected, to be fundamentally happy. And, you know, we can do it. It's just we need to have these conversations, and we need to have some training, and we have to have more people interested in it in a way that could be actually process oriented then, because we can sit and talk and nothing will happen, right?
For sure.
But we have to kind of train people as well, and hopefully get them infected with this in a sense that they'll be interested in it, right? And pursue it.
Absolutely. So Cindy's kind of been our poster girl here today. No, don't apologize. No, it's wonderful. I'm really happy that there's some questions that allows Anita to have some dialogue back. And I think that this is a question that probably other people have who are joining us today. So Cindy's asked, what does mediation cost? And is it covered by benefits?
I'm not sure if it's covered by the benefits. That would depend on the individual plan. So whoever you have to ask. I mean, whoever would be the person, quote, to pay. It might be partially covered by employment benefits, but that's by contract, so it will be quite varied. When it comes to sessions, the beauty of this is that it costs much less than litigation in the sense that people can chip in. So for example, if I were to, and I have sort of like a scale, so depending on the family, It could be $300, it can be $400 an hour, but if you have 4 or 5 people paying that, then you have each person pays less, and the agreement about how it's to be paid can be reached as well. It's not that one person has to cover the cost. Sometimes it's possible. I think, what did I want to say? Anything else? I mean, what I wanted to say was that elder mediators are essentially in private practice. So it's like lawyers, right? In a sense. So it really depends on the experience. It depends on the demand. It depends on essentially how helpful you are, I think. You know, and people will talk about this, right? Go see that person because he has helped my family. I get a lot of clients that way saying, you know, well, come see. And what's really funny is when I have the children of my clients who come to see me, and the children are, of course, adults. So I said, has it been really 20 years? I remember you. You were such a cutie, you know, like this here, mommy brought you. But anyway, so the word of mouth is good as well. But, you know, if the family, I don't know if legal, no, they wouldn't. I guess I wanted to say if legal aid would have any, I don't think so. No.
Would it, right. And would it be an option to, though, I mean, because to be a certified practicing mediator, you need to have that degree that you were speaking of, and one of those degrees is social work. Theoretically, if we had social workers who were qualified mediators working in nonprofit organizations, they could provide that service for, you know, whatever, based on whatever kind of process that their nonprofit organization has. Is that possible, Anita?
I think it depends on the standard that you want to follow, because when it comes to Family Mediation Canada, we have the Code of Ethics, and that's very important to me personally. But also I think it gives credence to this quote profession, because it is not regulated, right? So think about harm. I mean, it does take a long time to learn some of these steps and the knowledge, and how is quite complex, you know, how to navigate all of this. So I think any mediated conversation is better than conflict by all means. But then if something happens, how is it covered? You know, how would the harm be fixed? What rules would be followed? I mean, that's another conversation that can be, you know, in the form of a workshop or something like that. But when it comes to Family Mediation Canada, I think it's important to appreciate that there is this code of ethics. We have to have, you know, insurance. We have to follow the ethical canons, which is important because, of course, they give the sort of the uniform credence and recognition of the standard that needs to be followed by people who claim to be certified. You know, it scares me. It's sort of like in legal world, you know, medical, okay? Somebody who says, I'll heal you, okay, I'm a healer, but I'm not a doctor, right? But they're not telling you they're not a doctor. So you're going to believe that you're seeing a doctor, but really it's not a medical person, right? Or people who say, I'll give you legal advice, you know, I'll draft this contract for you, and they don't have any legal knowledge. I mean, the notaries do it all the time. I've seen that people coming to me saying, oh my God, I have this. I go, who did it? Well, it's a notary. I go, well, notaries are not lawyers. I think we are.
No, that's okay. I didn't want to, I'm like you, I'm not the you had mentioned at the very beginning before everybody came online that you had some support as far as technology goes, and I do too. And I was trying to get my screen back to share so that we could do our last couple of slides, Anita, but it wasn't not in an effort to cut you off at all.
Oh, no, it's okay. I'm not cut off. That's perfect. Okay. No, thank you. I can't believe that people are staying. For all of the ladies, I see the ladies. For all of the ladies who are still staying here, thank you for being here. I can't believe you're here. I mean, you are still here. Thank you so much for being with us for so long. Oh my goodness, I'm so excited. Thank you.
It's been wonderful, Anita. And just a couple of slides left. And if anyone is on the line who has not become a member of CORE, I invite you to go into the CORE Alberta website and join the CORE group. And there are other groups besides elder abuse that you can go in and take advantage of what some of the supports CORE Alberta is offering. So just to wrap up, Anita, I can't thank you enough for the time that you've given us today. Like I said, I could listen to you speak for hours. You're such an amazing speaker, and you have so much passion and experience and knowledge to share all of us. I look forward to where elder mediation might go in the province. Hopefully we can continue to have more of a conversation about elder mediation going forward. I almost think that there might be some other things we might be able to bring you on board to talk about as well, because you do have a number of topics that I think that you could probably, we could find some benefit in, Anita. So again, thank you so much to Dr. Anita Dorczak for joining us today. Thank you everyone for staying with us and asking such amazing questions. Our CORE team will be sending out a survey and evaluation early next week. So please take time to fill that out, as well as a recording of this session will be uploaded on the CORE website in the coming days. So Anita, I don't know if you have a couple of last words that you want to share.
Okay, here's the call to action. Let's do it. Come on, wake up. Let's do it, okay? Talk to everybody, talk to anybody and everybody so we can do it and we can change and we can become the province that actually will drive that change, okay? So forget the Atlantic Canada, woohoo! Let's just do it here in the West. Let's go wild, Wild West, okay?
That's awesome.
Just do it together. Thank you so very much for, I can't believe you're still here. I mean, thank you so very much for sticking around. And I hope to have maybe some individual conversations with you. The ladies who are smiling, I see the faces, that would be awesome. So thank you so very much. And I look forward to the evaluations. At any time I do present, I always like to review them. They are so instructive and let me, you know, sort of mold however and whatever I'm going to talk about in a way that would be hopefully interesting. And
we lost Anita right at the very end. I don't know why you froze up on us, Anita, but sorry, we lost your last couple of words there, Anita, but we're at 12:01. So again, thank you very much. Thanks to everyone for joining us today. Our next session in April will be on the topic of power of attorney documents and advanced care plans. So we haven't solidified the date yet, but look for that on the CORE Alberta website. Thanks again, everybody, for joining us. Thank you, Dr. Anita, and thank you to the CORE team for supporting this presentation today. We look forward to chatting with you next month.
Thank you.